Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 27, 2025. This video is on a JAMA review article titled Therapeutic Use of Cannabis and Cannabinoids, published online in JAMA yesterday, November 26, 2025. Interestingly, the Wall Street Journal had an article this week titled, "This year's Thanksgiving Surprise, half the guests are stoned." What started as a secret trip to smoke pot before dinner has mushroomed into a full-blown commercial holiday. The article says, be careful about this cousin walk. They return stoned and they rejoin the festivities with altered minds and a ravenous hunger. What did the JAMA paper say? Cannabis use is common. Evidence for most medical indications remain insufficient. FDA-approved uses include chemotherapy-induced nausea and vomiting, HIV/AIDS, anorexia, and select pediatric seizure disorders. Methods. They reviewed 124 studies, 21 guidelines, 7 systematic reviews, 3 meta-analyses, 10 randomized controlled trials, data from 2010 to 2025, preference for randomized clinical trials and large observational cohorts. Sample sizes and meta-analysis included up to 8,780 adults for spasticity and 5,100 adults for pain and sleep outcomes. Follow-up and demographics, they were variable in the different trials. Trials included adults and pediatric epilepsy populations. Observational studies included millions of US adults. Statistics. Standardized mean differences were used for symptom scoring. Effect sizes range from small, standardized mean difference of a minus 0.29 for nausea to large, minus 1.41 for multiple sclerosis related spasticity. What did they find? Small benefits for nausea and vomiting. Standard mean difference minus 2.29. Moderate benefit for HIV weight gain. Standard mean difference 0.57. And moderate reduction in seizures for cannabidiol. Strong benefits for nabeximols in multiple sclerosis spasticity. Limitations of the study: high heterogeneity, inconsistent dosing, limited long-term data, outdated randomized controlled trials, and lack of modern antiemetic comparison arms. Key takeaways: evidence is insufficient for most medical indications. There goes the medical marijuana card. Inhaled high-potency cannabis linked to psychiatric, cardiovascular, and cognitive risks. Consult regulations, check drug interactions, and use lowest effective dose. Clinical pearls: avoid inhaled or high potency, that is greater than 10% delta 9 tetrahydrocannabinol products, especially in patients with cardiovascular or psychiatric disease. CBD significantly interacts with CYP450 pathways. Monitor warfarin, tacrolimus, SSRIs, and anti-epileptics. Edibles have a delayed onset, 1 to 3 hours, and an increased risk of overconsumption. Heavy daily use is associated with higher rates of cannabis use disorder and cardiovascular events. Shared decision making is essential. The emphasis should be on harm reduction. These are some of the eponyms related to cannabis. The one that caught my eye is anandamide. Named from Sanskrit Ananda, bliss, by Devane et al. In 1992. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe and forward to your friends.